Hey guys, this is Dr. Jason Lipoff, and I'm a board-certified pediatric dentist. As you can see, I am filming today from my bedroom because that is my personality. My personality is video, not just writing things down on paper. And for those of you guys that don't know me, this video is intended to be a little bit of an introduction to who I am, if I'm going to be treating your child now or in the near future, and a little bit about what you can expect when you come in for your visit. 4 years ago, I opened up a pediatric dental office in Jeffersonville, Indiana, and I opened it up with a group, and some decisions had to be made, and so I am going to be opening up my own office with my vision completely in the very near future, and the plans are already in the works in Southern Indiana. So if those of you guys that have been eagerly awaiting where am I going to be opening up shop, stay tuned on that. But in the meanwhile, I have agreed to open up my schedule to a select group of general dentists that have been referring to me children that they have wanted me to see. And also for any other general dentists, I kind of want to span myself out in different areas in Kentucky and Indiana where there's a lot of children and that they think that they would benefit from me coming to the office a couple times a month. Because I'll dispel some notions that what we do or at least what I do as a board-certified pediatric dentist is not just treat children that are troubled patients that the dentist can't handle. I go far beyond the scope of just really treating kids that are not cooperative. So a little bit of background about me. Grew up in Chicago. I went to dental school down in Florida. And then I went into the military right at the beginning of Operation Iraqi Freedom. I was an Army officer for 4 years. It was actually for 3.5 years, and it was an amazing experience. I had a great time. In 2007, I knew that I wanted to specialize in pediatric dentistry, and at the time, it was one of the most difficult specialties to get into. So even though I had good marks, I actually for 2 years in a row, I did not match into a pediatric dental residency program because then I was told that I wasn't coachable, I wasn't teachable. So for 24 months, instead of treating kids, I was working in a high-end cosmetic practice in Chicago as an associate. And then finally I got the call and I got my calling. I spent a couple years in an amazing pediatric dental residency program in South Florida, where I learned so much about behavior management and pediatric medicine, and really, how to establish a mindset to be able to treat our future generations. So when I opened up, I was looking at different areas, and my reason for wanting to go to Southern Indiana was, number one, there's a huge need. I'm from a big city, and in a lot of areas in small town America, there's these families with instead of 1 or 2 children, they're with 4 or 5 children, and the economy has really hit them hard, especially when everybody got hit in 2008, and people are just struggling. There's still a lot of kids. The education of learning about diet and nutrition and getting proper oral dental care or medical care just really isn't there, and especially the Medicaid population, I feel like they weren't getting the attention that some of them deserve. So I had agreed to forego going into a bigger city, and I went to Jeffersonville, Indiana. And I was familiar with the area because I was stationed at Fort Knox when I was on active duty. So I moved to the area and we opened up the practice, and very quickly in 2011, we had built up a following, and it was a little bit because I joined up with a group of the corporation, so it took a little bit of time to gain the trust of the local general dentists that were that they didn't know me, and so they didn't really know what kind of services I had to offer. But over the course of 4 years, I felt like I had earned the respect of a lot of my dental colleagues and medical colleagues. And it really kind of became known what I was really good at. I'm always a fan of focusing on your strengths to make the biggest impact, not everything. And so that's what's so great about with dentistry, is that you've got different specialties. So, endodontics, pediatric dentistry, oral surgery. With pediatric dentistry, your strengths is children, dealing with children, but also the whole family as it relates to children. So my focus is twofold. Number one is my clinic practice, my office practice, and then also my hospital cases. I'm going to be sending you a link of a lot of the things that I do, partially because of my surgical background, that I'm able to do for a lot of the children that I see, and it could be your son or your daughter. The oral rehabilitation cases that I'm able to do in a hospital setting it's unlike things that we've ever been able to do before with the advances. So where teeth previously had to be taken out or extracted for a 2 or a 3-year-old, I'm able to many times give that child a smile for several years, really helping their psyche and really giving them, really forming the foundation that they deserve as a child growing up. And then I spend equal time focusing on diet and nutrition. And I'm not all about all my staff and everything. They're all extensions of me, and that's all what I plan on having in my new office. But what my focus is going to be is it's almost like a pseudo therapy session. Like, there's no rules. So there's no I don't believe in strapping kids down, beyond beyond what they want. This is all about helping parents understand what do cavities mean. Most of the time, cavities mean that their diet's imbalanced, and so we'll kind of start to make small changes, but within the lifestyle. So we all know that life gets in the way. There's a lot of problems. I've become very understanding for people's lifestyles, and this is about interaction. So I'm all about really keeping in touch with the families that I treat. My wife and I, my wife Brooke, who's a hygienist, we're very active on social media. So we have a Facebook page, we've got a Facebook like page, fan page, and we use those especially with a lot of the families that we treat, because I think it's important to connect with each other both on a personal level and a professional level, to know that, hey, listen, I do think that I'm the best of the best, and I do think because I dedicate my life towards learning about connecting with people of all walks, of every age, creed, set. It doesn't make a difference. And my job is to really connect with people to establish trust and to really be empathetic towards your needs. And in the end, the result is a happier parent, a happier child. And I want you to know that when you see me, if you see me at your general dentist office, is that I'm all about connection. I'm all about conversation. So the exam is not just looking at the teeth and then just saying, oh, no cavities. It's talking about personality. It's talking about, are you having problems with your child? That's another one of my strengths. My strength is helping people work through their problems and their stresses in life. You think that one thing doesn't have to do with the other, but when you're unhappy in your life, especially as a parent, it's hard to parent. And also, it also could be a problem maybe with your marital life, but also what happens is your children get affected, even though you think that, they don't see anything. It happens, and life is hard. I mean, most of us are living paycheck to paycheck. I work on those things, and you say, well, what does that have to do with pediatric dentistry? Pediatric dentistry is kind of like it's basically the bridge. It lets me connect people, parents, men, women, and children to each other. It connects them to me so that we can start the conversation. It just happens that I have a passion for pediatric dentistry, but I have a passion for helping people. And one of my strengths is really connecting with people that you would think that I have nothing in common with, and yet I can find something, and I actually care. So I want you guys to know that I look forward to seeing each and every one of you. You're always welcome to email me even before you see me. Introduce yourself. You can reach me at jasonlipoff@gmail.com. I'm going to send you a link to some before and after video pictures of some cases that I've done, but it's not really to show you my track record. It's really to show you that, hey, listen, I'm one of the good guys. I care. I want to let you know that if I make a recommendation about their health, about their oral health, about their teeth, that it's not about, oh, it's just baby teeth and they're just gonna fall out. This is about giving a child a foundation to really succeed, and also for all of you parents to let you know that wherever you are in life, wherever, if you're extremely happy, sad, if you're totally lost, it all starts with one step and one day, and that's what I'm here for. So well beyond the scope of being a board certified pediatric dentist. So again, I wanted to introduce myself, and in terms of where I'm going to be building my own practice, again, it most likely will be in Southern Indiana, and the answer is why? Because I absolutely fell in love with each and every family that came through my office door. I mean, you guys are just amazing, and it's, I don't know, I just can't I can't put it into words, and so I wouldn't want to open up any other place, and I feel like the place for me to start with my vision of what I expect, there's no other place. But every single general dental dentist office that I'm able to see patients right now, I want you to know that I aim to help inspire the staff to be able to continue to treat children in a manner that I do, and to treat families in the manner that I do, and hopefully that I can inspire as much goodness and motivate everybody to just make a positive impact on each other and on life in general. So, all right, guys. If you've got any questions, if you want to make an appointment, if you want to know my schedule for what offices, or if you're a dentist office and you have an interest in having me come see patients at your office, or even do I do half-day seminars or quick lunchtime seminars on certain topics within pediatric dentistry, or overall communication with patients on how to really gain the trust and credibility of your patients, even as a general dental office. I'm more than happy to do that, or to do webinars, whatever. I'm even more than happy to do video calls with you parents, because I'm really trying to establish a new trend that hasn't been done before. So have a good night, guys, and I'll see you soon. Bye.